Can you introduce yourself and tell us something about how you and your family is involved with MPS?
I am Kimberly Frye. I'm from Southern California. I am a clinical psychologist. I'm a former board member on the National MPS Society Board of Directors, vice president. As I last left, my son Jack has MPS II, Hunter syndrome, was diagnosed in 2004 and has been on enzymes since 2006. He has an older sister, Nicole, 12 years old.
Could you summarize what your talk, your presentation was about today?
I spoke about empowerment in making decisions from a patient perspective, why that's important, and how to be actively involved in the process and not purely a recipient of the directions of our physicians.
Yeah. How much of your personal or professional time do you spend on MPS and related diseases?
Well, obviously, personally every day. Yeah. However, professionally, more so in the last 7 years than I do right now. I'm having stepped down or retired from the board in December. There's been less professional time working in the community. However, I'm active in the conferences, and I participate and present at all the conferences that I'm asked to. So that's kind of where I've had to build that peace, keep that peace back in my professional life. So,
what do you think of the conference so far?
I think these international conferences are wonderful. I think having an opportunity to meet other patients and other families and to have direct access to the scientists and the physicians is an unbelievable experience. I wish more families had the opportunity to do that. I know in the States it's one of the things that has always driven our conferences that we hold. We move around the country so that as many families can have access to us as possible. As you know, this international conference moves around the world, so hopefully as many patients as possible can have access to other families. Since it's such a rare disease, I think it's really important to connect. I think the conference is wonderful. I think the time and care given to have such a diverse amount of presenters as well as families represented is one of its biggest strengths.